This is our new primary care billing sheet. We hope that this will go away so we never need to do this, and in order for it to go away we all have to make sure that we document what we are billing. In general, you'll see that this sheet is yellow on one side and white on the left. On the right side is mainly for our MA and nursing billing. On the left is mainly for provider billing. So for APPs and physicians, we mainly just focus on the white half of this sheet. We divided this up into different sections. The first section is your visit code. As you can see, if you've not seen a patient within 3 years, you should code a new patient. If this is an established patient, you would check one of the established patient boxes. And if you are doing a consultation, if you are referred a patient for sports medicine or maternal child health, you can use the consultation codes. As you can see, the time is in parentheses, and if you code by time, you just have to make sure that you put in your note that 50% of your time was spent in counseling and organizing the patient's care. The next section is for preventative medicine for child checks and annual physicals. But if you do have someone who comes in for an annual physical and their blood pressure is elevated and you have to spend time and effort talking about the new medication you put them on or lifestyle habits to lower their blood pressure, then you would also circle the 25 modifier box and then code a visit code such as a 99213. The next box is a box for providers, and this will be unique to each clinic based on the providers at that clinic. At the bottom of that provider box might be other health professionals such as a psychiatrist or a pediatrician who also sees patients at that clinic. At the very bottom is the resident and a checkbox for if you actually saw the patient with the resident or not. When we do see the patient, we are able to adequately code a 99214 if it's a complex patient. Again, checking this box on this sheet is less important than actually documenting it in the note, since that's what the coders are mainly looking at. The next box, which is the one with the most significant changes, is the counseling box, and we're going to go through each of these specifically. As David Scrace would say, this is Medicare trying to pay us more money in primary care for what we do anyways. The first sections are counseling codes for alcohol, cardiovascular risk, depression, diabetes, obesity, and smoking cessation. Let's look at the smoking cessation one. We just need to talk about smoking cessation for 3 minutes. What are some of the barriers? What are some of the risks for recurrence? What can we do to manage that risk of recurrence? And what are we going to do as the next step if this first step doesn't work well? 3 minutes is all it takes beyond your regular visit code to check this box. Cardiovascular disease risk. This needs to be 15 minutes beyond the time spent in the visit code. So if I code a 99213 for 15 minutes, but I spend another 15 minutes figuring out their 10-year Framingham cardiovascular risk, talking about the benefits and risks of a statin, and discussing how we need to check their cholesterol and do follow-up. We need to make sure that we document the time we spent talking about that risk and what we discussed during the visit to check this box. These are the G codes. The next section is annual wellness visit. The first box is for the first 12 months that someone is eligible for Medicare. For most people, this will be from ages 65 to 66. The second box is for the following year, from ages 66 to 67. The third box is every year after age 67. So if someone's 68 or 69 or 70, you would check the third box. The next box, practitioner assessment form. We are seeing a lot of forms coming in that insurance companies want us to fill out that assesses the patient's unique risk, and that form takes time to fill out. So if you have to fill out any insurance form based on the patient's unique risk, you would check this box. The next box is the Transitional Care Management Codes. This is probably the most rewarding box Medicare is giving us that pays 3 times the amount as any other code on this sheet. This is for seeing patients within 7 days of the hospital. That would be the first box. Most people who are admitted to the hospital are sick enough that we need to see them within 7 days, and they have high complexity. If they don't need to be seen right away and they're of less complexity, that's usually from days 1 to 14. So if someone comes in on day 12 and is doing fine and they're not real complex, you would click that box, the second box, but most of the time we're going to click the high complexity box within 1 to 7 days. Dr. Scrace created a equals phrase that really helps us meet the requirements for this, and that's equals TCM, equals Transitional Care Management. The next block is Advanced Care Planning. This is after your initial 15-minute 99213 visit. If you spend time after that, from minute 16 to 45, talking about advanced care planning, their code status, what they want at the end of their life, the power of attorney, all those things can now be coded for in these advanced care planning boxes. Rarely are you going to click this second box, but if you spend an excessive amount of time with an elderly patient talking about advanced care planning and you get to each additional minute after 45 minutes, then you would click the 99498 box. The chronic care management box we don't need to focus on right now. This is put here for the future, as Medicare is now giving a monthly reimbursement for managing complexity, and this will help us document that as we prepare for billing for the chronic care management monthly fee that it takes to manage some of the complexities of the patients we serve. The next is the procedure box, and this will be unique for each clinic, and each clinic will go through and put the procedures they do most in this box. If you do a procedure that's not in this list, there's a box at the very bottom that you can write in the procedure that then will flag the coder to look up the code and bill appropriately, assuming that you put that in your note and explained it thoroughly. If you have any questions about this, Alice Torres in the Coding Educator office is here to help. Her number is listed on the screen, 272-3891.